Everyone is doing peptide therapy wrong. They're stacking compounds, chasing protocols, running things like the Wolverine stack, and then wondering why their results are inconsistent, or worse, why nothing is happening at all. It's not because peptides don't work. It's because they're being used at the wrong time, in the wrong system, for the wrong reason. My name is Ryan Thomas. I'm a naturopathic doctor and the founder of Praxis Peptide Institute. And what I'm going to show you right now is the shift that changes everything. You don't match peptides to the condition. You match peptides to the phase of healing. Every patient, no matter what they're dealing with, moves through three core phases: stabilization, repair, optimization. If you don't understand where your patient is in that process, you will constantly misapply peptides. Let's start with phase 1, stabilization. This is where most clinicians and patients get it wrong. They come in aggressive. They want results fast. So they jump straight into stimulation, growth hormone peptides, repair peptides, stacking multiple compounds. But the system isn't ready. Clinically, stabilization looks like this: poor sleep, high stress, elevated inflammation, erratic energy, inconsistent recovery. This is not a system that needs to be pushed. It's a system that needs to be stabilized. If you try to force repair or growth in this phase, you don't get better outcomes. You amplify dysfunction. You'll see patients feel worse, plateau quickly, or get unpredictable responses, because the system doesn't have the capacity to respond to the signal you're giving it. This is where restraint becomes one of the most important clinical skills. You stabilize first. And here's the key. This phase is not based on time. You don't say, "We'll stabilize for 2 weeks and then move on." You move when the system shows you it's ready. Sleep improves, energy becomes consistent, inflammatory symptoms decrease. Now, and only now, you move into phase 2, repair. This is where peptides actually begin to perform the way people expect them to, because now the system can use the signal. Repair is about restoring function, improving tissue integrity, enhancing signaling pathways, rebuilding what has been lost or impaired. This is where targeted peptides can be incredibly effective. But this is also where the next mistake happens. People overstack. They think, if one peptide works, 5 must be better. So they start combining multiple compounds, hitting multiple pathways, chasing multiple outcomes, all at once. And what happens? They lose clarity. They don't know what's working. They don't know what's not working. And they can't adjust intelligently. The rule in this phase is simple. One primary driver. One clear goal. Observe the response. Because repair is not about doing more. It's about doing what matters most and letting the system respond. Once repair is successful, once function is restored, recovery is consistent, and the system is stable, you reach a decision point. Do you stop? Or do you move into phase 3, optimization? Optimization is where performance and longevity strategies come into play. This is where people want to start, but it only works if the previous phases were done correctly. Now you can enhance performance, recovery, capacity, long-term resilience. Now more advanced combinations can make sense, but they are controlled. They are intentional. They are built on a system that can actually respond. If you try to optimize a system that was never stabilized or repaired, you will always get limited results. So here's the takeaway. It's not about which peptide is best. It's about when you use it, why you use it, and what system you're applying it to. If you match the peptide to the phase, outcomes become predictable. If you don't, you will keep chasing protocols that don't work. This is the difference between guessing and practicing with precision. If you want to learn how to actually apply this in clinical practice, how to assess patients, identify their phase, choose the right interventions, and build strategies that evolve over time, that's exactly what I teach inside Praxis Peptide Institute. You can go to praxispeptideinstitute.com and take the courses, where I break this down step by step across every system every phase, and every level of complexity. Stop stacking, start thinking. That's where outcomes change.